Hi everyone, this is Valerie McGraw from the Myofascial Release Treatment Center in Malvern, Pennsylvania at the Sanctuary, and I'm here with another tip for the day. And today I want to talk to you about some things to remember when you're teaching your patients or clients how to self-treat the psoas with the small ball. There's a couple of ways to make it an easier, smoother self-treatment to start. I think one of the things that happens while some people may be hesitant to treat the psoas is they go in and the pressure's too deep too quickly. So I'll show you some positioning for that. But just as a quick review, the psoas, and this is important for our patients and clients to understand why we're treating this area, is to remind them the psoas is a back muscle, but it runs on the front part of the spine. We get to it through the belly. So it runs from T12. It attaches to the lumbar, T12 and all the lumbar vertebrae, as well as the disc. So when it gets tight, it creates some vertical compression. It jams the low back and facet joints together, and it can tip them forward. It also, when it attaches directly to the disc, so it can be a contributing factor for disc bulges. So it's a very important area to treat to help with pelvic problems and low back problems, as well as pain throughout the body. So just as a review, we're going to use a 4-inch diameter air-filled ball. We use the all ball by Sport Time, and when we instruct our patients how to use this, it's about an inch or so out from midline, anywhere from here down toward the pubic symphysis. Okay, so the 3 phases I'm going to show you. The first phase will have medium pressure or mild pressure. The second phase will have medium pressure. Third phase will have deeper pressure. So when they get down onto the ball, one of the things they'll want to avoid is they don't want to come down on elbows and stick it in like that, because it's on stretch and it'll be more uncomfortable. They need to get all the way down flat. And if I were to work on my left psoas, I would start by turning my head toward the left. I'd put the ball in about an inch or so out from midline. Around the belly button is a good place to start, but it could be above or below the belly button. And then my leg on the same side of the ball, the left side, is going to be kicked out just a little. Not way up here, just a little bit, okay? So whatever side they're starting on, head turns to that side and legs kicked out that side. Make sure the back arm, and if you look at this from above, the back arm is down. If it's left up here, they can't roll off the ball. So can you see that most of my weight is on the opposite side, and there's very little weight over the ball. So this is an easy way to start. And then they're going to take a couple deep breaths, soften on the exhale, and let the pelvis drape over the ball. Give them that image. Imagine lighter energy coming into the space wherever they're treating. Now they'd spend a couple minutes or so in this phase. You want to ideally do this on the floor. The bed is too soft. So after a couple minutes, or if they're not feeling too much in this phase, they can go right to phase 2, which is the middle position. So for phase 2, head is in the middle, legs come together, and now can you see that more weight is on the left side? It's kind of evenly distributed, okay? The ball is still in the same place. And again, I take a few breaths, softening on the exhale. As you first get on the ball, you may feel some tenderness, but after a minute or two, it should get easier. If they're holding their breath or they're not exhaling fully, that would be considered bracing, and that's too much. So then they should back off by turning their head back a little bit or kicking their leg up. So this is phase 2. They stay here for a few minutes until it gets easier. And then phase 3 would be the deepest pressure, and my head would be turned toward the opposite side of the ball. So the ball's still on the left, my head would turn to the left, this opposite arm would come down, and my right leg, my opposite leg, would kick up a little bit. So it'll look like this, okay? And now can you see that I have more weight over the ball? This is giving them the deepest amount of pressure. and I would stay here for several minutes. If it was too much in this position, I would go back to middle position, okay? So just as a quick review, phase 1, with the ball on the left, okay? Phase 2, and phase 3. And then when they get off the ball, they shouldn't press up like this. Just have them go back to the beginning, take the ball out, and then they can go ahead and get up. So try that out. I think it'll allow patients to tolerate this more easily to begin with, and they'll be able to stick with it longer. They should lay on the ball ideally 10 minutes aside, okay? They could start out 5 to 7 minutes aside. It's better just to focus on one spot when they're doing the psoas. They'll pick the most tight or tender area rather than moving around. Some people think, they'll work 3 spots on each side. It's better off to stay with one area of tightness or tenderness and stay there for a longer period of time than it is to move the ball around. So try that out. Let me know how it works.